Here's something that might surprise you. Your arteries aren't clogging up like a rusty pipe. They're actually injured, and your body is trying to bandage that injury, except the bandage it uses happens to be cholesterol. And over time, that bandage becomes the blockage itself. If you've ever gotten a cholesterol number back from your doctor and felt a wave of quiet panic, I want you to know that feeling is completely normal, and you are far from alone. Most of my patients come in thinking this is simply about eating less fatty food, and honestly, I used to think that too earlier in my training, but the real picture is more precise than that. And once you understand it, you stop guessing and start actually targeting the problem. That's what today is about. And by the end, you'll understand exactly why your arteries get damaged in the first place and which foods genuinely help repair that damage, not just foods that sound healthy on a label. If that sounds useful to you, go ahead and subscribe now and stay with me until the end because I'm going to walk through the foods that create the biggest shift first and save two lesser known tools, one about movement and one about a supplement with real evidence behind it, for later in the video. So here's what's actually happening inside your blood vessels. The inner lining of your arteries is incredibly thin, just one cell layer, and it can get damaged by things like high blood pressure, high blood sugar, and smoking. Once that lining is injured, cholesterol particles that carry a protein called ApoB can slip underneath it, almost like water seeping under a crack in a garden hose. Your immune system notices those trapped particles, especially once they've been damaged by oxidation, and it rushes in to try to clean things up. But instead of clearing the mess, the immune cells often get stuck there too, and the whole area swells and hardens over time. That swelling is what we actually call plaque, and it's the direct result of injury, infiltration, and an immune response that can't quite finish the job. Once you see it this way, the foods that help start to make a lot more sense because each one is targeting a different part of that same chain reaction. Let's start with a bright red pigment called lycopene, which you'll find in tomatoes, watermelon, pink grapefruit, and guava. Lycopene is one of the most powerful antioxidants we know of, and its job is essentially to neutralize the oxidative damage that turns ordinary cholesterol particles into the sticky, inflamed kind that triggers this whole cascade. Research following large groups of people over time has linked higher lycopene intake with slower early progression of arterial plaque, particularly when tomatoes are cooked, since cooking actually makes lycopene easier for your body to absorb. We're about 3 minutes in now, and if this is helping connect some dots for you, I'd really appreciate you hitting subscribe, because the next food is one that surprises almost everyone I explain it to. That food group is called phytosterols, and you'll find them in flaxseed, sesame seeds, walnuts, and leafy greens. Phytosterols are plant compounds that look almost identical to cholesterol at a molecular level, which sounds strange, but here's why it matters. When you eat them, they compete with cholesterol for absorption in your intestine, so less of it gets through in the first place. And here's the part that surprised me most in the research. Your liver actually senses that drop, and to keep things balanced, it pulls extra LDL particles, the ones carrying ApoB, out of your bloodstream to compensate. Multiple analyses pooling this research together have found this can lower LDL by a clinically meaningful amount, simply from a small daily habit, like sprinkling ground flaxseed over oatmeal. Flavonoids are the next piece, and I like to think of them as calming agents for irritated blood vessels. You'll find them in berries, apples, onions, and yes, dark chocolate in moderation. Their job is to make the inner lining of your arteries less sticky, so fewer immune cells latch onto it in the first place, which slows the whole inflammatory cycle down at its source. One particular subgroup, found in green and black tea, has been linked in pooled research to a meaningfully lower risk of stroke among people who drink several cups a day compared to almost none. Extra virgin olive oil deserves its own mention here, because it seems to work on more than one front at once. Its polyphenols calm inflammation, support the health of that damaged inner lining directly, and even appear to improve how sensitive your cells are to insulin, which matters because elevated blood sugar is one of the things that damages arteries in the first place. And then there's fatty fish, like salmon, mackerel, and sardines, rich in omega-3 fats. These don't just lower inflammation in a general sense, they actually help your body increase nitric oxide, which is essentially a signal that tells your blood vessels to relax and stay flexible, and research following large groups over many years has linked higher omega-3 levels with slower progression of plaque in the arteries feeding the brain, the same plaques that can eventually lead to a stroke. Now, we're at the halfway point, and I want to pause here because just as important as what you add is what you watch out for, and this next part might genuinely surprise you. Some of the biggest offenders hide behind a health halo. Flavored yogurts often carry as much added sugar as a dessert, so a plain, full-fat yogurt with your own fruit added is almost always the better choice. Granola bars marketed as heart-healthy frequently list sugar among the first 3 ingredients. And fruit juice, even the kind labeled with no added sugar, delivers concentrated natural sugar without the fiber that would normally slow its absorption, which matters because sugar spikes are part of what damages that delicate arterial lining we talked about earlier. If you've made it this far, thank you for genuinely wanting to understand this the right way. And if you haven't yet, this is a great moment to subscribe because I've got 2 more tools coming that most people never hear about from their own doctor. The first is exercise, and specifically higher intensity interval training. A clinical trial published in a respected cardiology journal followed patients doing 6 months of supervised interval training and found a reduction in plaque volume that was actually slightly greater than what's typically seen with cholesterol-lowering medication alone. That doesn't mean exercise replaces medication when it's needed, but it tells us movement is doing something real at the level of the artery itself, not just burning calories. The second is aged garlic extract, which has actual clinical trial evidence, not just tradition behind it. Research following patients over a full year found slower progression of calcium buildup in the coronary arteries, along with modest improvements in blood pressure, among those taking it consistently. So here's what I want you to take with you today. Your arteries are not simply clogging like an old pipe you can't clean out. They're responding to real specific injury, and every food we talked about today is aimed at a different piece of that injury and repair cycle. That means you're not stuck waiting and hoping. You genuinely have tools that target this process, starting with your very next meal. If this helped you understand your own heart health a little more clearly today, I'd love for you to subscribe and join me for the next video, where we'll keep building on exactly this kind of practical, evidence-based understanding together. Take care of yourself, and I'll see you soon.